3.
Okay, welcome guys. We're here at a conference today in Ohio. Ohio Center for Adolescent Moms is putting this on. We have nurses from across the country with us today, joining us for a short training. And I'm Julie. I am a researcher at OCAM, Ohio Center for Adolescent Moms.
Hi, I'm Manasa. I've been a labor and delivery nurse for 20 years. I've experienced a lot of teenage pregnancies in my nursing experience, and I wanted to learn more about them. So I joined OCAM, and I'm here to share some of my stories with you guys today.
Perfect. So just to start it out, we have a question for the participants. What stories can you share about caring for this population?
Yeah, so I'm a clinical educator here in Ohio at one of the hospitals on the labor and delivery floor. And so one thing that I've noticed quite a bit is just the teen moms seem to just feel very isolated and alone. I've seen a lot of them have lack of support either from the community or from their families, and just overall feeling of fearfulness. So
Yeah, I would definitely agree. I feel like in my clinical practice, I've seen that a lot too. But you know, it wasn't always like this. Historically speaking, teenage pregnancy used to be considered a normal thing compared to now, and the highest population of pregnancies that we have in teenagers are the 15 to 19-year-olds. And we saw this switch in kind of the decline of teenage pregnancy in the 1950s, and this was due to like contraception becoming more popular and education about safe sex practices. But you know, we're talking about this in the case of just America, but you know, teenage pregnancy values definitely vary across the world, and they change from country to country.
And in terms of some other unique childbearing practices for this population is that they face a lot of critical social economic issues, and that includes poverty, poor access to health care. There's a lot of smoking in that population. The education piece is important as well. You know, after the mom has the baby, she might not go back to finish her education, and just child welfare issues with increased risk of health problems. And those can vary. And also just emotional stress. I mean, she's already in a stressful time of being a teenager, and her body is changing and going through all of that. And so this can put forward a lot of self-centered behavior and decreased economic opportunity. So there's just a lot of unique practices with the teen population. And that brings us to the nursing care specifically. So for you guys, what are some specifics in your nursing care that you may have implemented for this population?
yeah, so some questions that I like to ask at first when I see my patients are, you know, was this a planned pregnancy or was it unplanned, and how do they feel about it? And also just questions about support as well.
Yeah, I think that's a really great thing to ask at first, because it's important not for us to assume that this was not a planned pregnancy like we do with a lot of teenagers, because for some people it could be a planned pregnancy and they could be very happy about it. I think, like you said, another thing that's great to ask is just how they're feeling about their pregnancy. What do they want to do? What do they know about their pregnancy already, and what do they want to learn about it? We've learned that with teenage pregnancies, they have a lot of more mental health complications going on. They have higher rates of depression, PTSD, stress, and substance abuse. So we can definitely ask them about this as nurses. We can give them screenings about depression, ask about their stress, if they're using any substances like cigarettes or alcohol or other things. And another thing that teenagers have a high risk for is physical abuse, more than other populations. So definitely asking them if they're safe at home, if they're comfortable with where they are, and giving them resources for this would be a great thing that we can do as nurses. And another thing that's very specific to this population is that teenagers in general have a social network that reaches outside of just their house. They are more likely to depend on their friends and other people outside of their immediate family. And so asking them about who is important to them and who they want involved in their care is a great thing that we can do to bring other people in and make them feel more supported.
For sure. And more on the physiologic side, we can educate them on, you know, some things that they're more at risk for because of their age. And you want to be careful here. It's going to be a balance because you don't want to overwhelm them. They're already going through so much. And again, you know, you don't wanna assume that they want to know in depth about all of these things. So you can, you know, give them a general idea about the risk for things like postpartum hemorrhage, proteinuria, preeclampsia, anemia, depression, risk for mortality, and alcohol use and cigarettes, and placenta previa, just a couple things that they could be more at risk for with their age. And the nursing care for that is just to encourage the follow-up visits and to try to get those scheduled and to understand if there's any barriers for why they might not be able to come to those visits. Another thing is education with this population, especially regarding safe sex. And so maybe something that we could do for our nursing care is to look up local clinics in their area where they might have free condoms or pamphlets with tons of information that they can learn more about how to be safe in their practice. And vitamins and malnutrition is another big piece. So we can educate them about that. We can get them nutritional counseling as part of our nursing care, and just stress the importance of staying up to date with your vitamins and your nutrition.
So what are some challenges that you guys have had like with your nursing care in these populations?
Yeah, so I know that like social support and financial constraints are super big, but one thing that I wanted to discuss was the law here in Ohio for underage or minors under the age of 18 who are in labor. They can actually not consent to their own epidurals or elective C-sections, and so I just found that appalling.
And then back in Colorado, if a teen mom wants to have an abortion during her pregnancy, the physician needs to notify one of her parents within 48 hours. And I also think that's a pretty big challenge to overcome.
Definitely. Yeah, a lot of challenges in this population, and that brings up a great one, just the whole parental consent and the whole, patient versus parent dynamic. And as a nurse, we're really facilitating that with them. We are the patient's advocate, but it's just a little bit different than normal with the minors. So that's a huge challenge, especially as you consider different states and different laws. Another challenge we see is the prenatal care, and that kind of ties into the parents as well sometimes, and also the patient too. Just lack of resources, whether that's money or insurance or just different cultural beliefs or knowledge. And again, that can go on either side of the patient or the parent, and that can contribute to the low rates of prenatal care in early stages. The other thing that can happen is a desire for confidentiality. A lot of patients in this population won't seek care if they don't know that it's going to be confidential, because there's just, in general, there's a lot of shame around getting pregnant at that age, and they just want to be really careful about how they're planning their care. So yeah, lots of challenges in this population for sure.
Okay, so those are all great methods. How can we tell if these methods are effective?
Yeah, for sure. That's a really great question. Things that we can do is to make them understand their options and make informed decisions, is to simplify language for them when we're telling them about procedures and care, and making sure that they understand what we're saying. We can also give them specific antenatal care that's just specific to their population, to teenagers. And we can see if it's working by seeing if they're changing their health behaviors. Are they eating healthier? Are they exercising? Are they staying active? How's their mood? Are they improving? Are they sleeping better? Are they giving up alcohol, drugs? Are they finishing school? All these are good ways to just see if they're improving and listening to what we said, and if our education's going through to them.
Okay, and I also found a study that said like the top 3 most important nursing actions, and I found that the top one was emotional support, and the second one was informational support about hospital policies and procedures, and then the third was tangible support, including assistance and making the mom feel comfortable. Does that sound right?
Yeah, that sounds like 3 things that I've definitely seen in my practice, and I feel like if we're doing all this, they will also feel much more supported in labor. So
Yeah, so I think we shared a lot of information today that you can take back to your teams. Thanks for coming.
Thank you.